It's a topic many are a little bit shy to talk about, and city doctors are trying to change that.
How colon screenings can save lives and where you can get one for free. 7:52 is the time. It is a subject most avoid discussing unless, well, you're behind a closed door in your doctor's office, but colon screenings are vital to longevity. Here now to discuss a free screening program is Tiombe Mitchell, colon cancer program nurse from MedStar Medical Hospital. Thank you so much.
You're welcome. Thanks for having me.
It is one of those subjects where you don't discuss it. You know, most people don't bring it up on their own. It's mainly just, with your doctor. But there are certain reasons why we need to have it done. And really specifically, you're finding out even more and more that colon screenings are very important. Tell us about that and who needs to get one.
Sure. It is something that we need to talk about more. And it's very important to do it regularly and early. Colon cancer is a abnormal growth of cells that start in the colon. They can spread if left in, and it usually starts with a polyp or a growth in the inner lining. So if those are not removed, there's a possibility it can turn into cancer. So we are encouraging everyone to come in at age 50, or if you have a risk factor, such as family history, or you've had a screening before, had a polyp removed, then come in earlier than age 50 and have your screening done to look for these polyps and hopefully remove them.
Is this an annual exam?
No, it's not. It's really based on the findings. There are several ways to test. So if you have a FIT test, which is a stool test, that is done annually. If you use our gold standard, which our program uses, of colonoscopy, it's based on the findings. So it could range from 6 months to 10 years. It just depends on what the physician finds. All right,
and specifically MedStar, though, is working with a grant for certain people. Tell us about that and who's eligible.
Sure. So MedStar received a grant from the Department of State of Mental Health and Hygiene, and it's 3 years. We start screening at age 50, or like we said earlier, if you have a history, for Baltimore City and Anne Arundel County residents. It's based on income and age, but please call our number. We are looking to bring people in early, get the screening done so that we don't run into issues later on.
And that number right now is on our screen, 410-351-8216. Now, I know that there was a goal in mind, too. You were trying to get as many screenings as possible. That number, I believe, was around 250. Is that correct?
No, it's actually 320 for our program. The city is also working on, with the American Cancer Society, of getting 80% of the population screened by 2018. So we're working on that as well. So
one last thing before we go. An RN, you've been dealing with this, you've done colon screenings before lots of times. What do you tell people that are patients that are saying, you know, it's just too weird, I don't want to do it, are very hesitant?
So I encourage and I tell people all the time, this is something that is curative as well as preventative. So it's important to talk to your doctor, talk to your family members, and get the screening done. If you don't have the screening, we don't know what's there, and it could possibly be an issue for you later on.
All right. Thank you very much. We appreciate that. Tiombe Mitchell from MedStar Medical Health. Thank you so much.
You're welcome. Thank you.
Well, there's been a break in